let's say someone comes into the clinic and they're complaining about a pain in the heel of their foot. You know, what's that likely to be?
It can be a number of reasons. First of all, we'd actually have a look at the patient sat down, have a feel of the foot, see if there's anything jamming, anything moving, and then I get them standing up on the treadmill and have a look at them walking. Usually what's going on with that heel, there's 26 bones in the foot.
Wow.
Heel bone is the largest one, the calcaneal bone is the largest one. So to imagine every strike that foot is doing, imagine the amount of pressure, the force that's going on that heel. And basically what we need to do, support the foot, protect the arch, rest it. And if we can do that, great. If not, then we'll start looking at treatments. So first of all, get an X-ray and an ultrasound in there because we want to make sure we get the true diagnosis. And then we would look at a treatment plan, the exercise regime. And then if we need to, we can look at shockwave therapy, which is increasing the circulation to the area. And there's different treatments we can do with that. Or if the patient needs it, then we can look at orthotics. They can even be short-term orthotics, or we can go down the long route down with orthotics prescription.
So now one for more, I guess, female specific.
Ladies like to wear beautiful shoes, and of course they make your leg a lot more elongated, so we want to wear them. We want to look beautiful when we're at work and in the evening. So what happens is, because the actual shoe is tapered, well, obviously your toes aren't pointy to begin with, so they have to bunch up in the shoes. So then you've got the 3-inch heel. That's going pressure from the heel onto the actual forefoot, onto your toes. So we're squeezing in the shoes. So we're going to get rubbing normally on the 5th or the 1st, and you end up getting a little bit of corns or calluses. We see a lot of patients that just come in with corns on the tops of their toes, or even like little red marks. They're actually little bursas. Right. We can stop that. We can reduce it by reduce the amount of pressure that's there. So basically, we change your footwear up. But a lot of ladies, they don't want to change their shoes, and I don't blame them. A lot of the patients come in and we just tidy their feet up, we take the corns off, take the callus off, and it doesn't hurt. It's like having your hair cut, because we're just taking off layers of dead skin. Great. And then we always say to the patients, when you get home, just try and do some exercises, spread your toes apart and do some arch crunches to help maintain the muscles and the structure of the foot.